Welcome back to Tales of Truth podcast, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my co-host, JoJo, veterinary nurse extraordinaire. And today we are going to be talking about kidney disease in cats. I love talking about
Yay.
kidney disease.
Well, that's because we see it all the time,
Every day.
every day.
There's not a day that goes by where I am not treating a cat that has kidney disease. And they have kidney disease for years and
Uh,
years and years of their life.
yep. For years before somebody finds out they have kidney disease, or before they're presenting with symptoms, or for years and we know all about it.
Yes to all of
That's
those.
what I thought the answer was. Yes, yes, and yes.
So if you're checking your cat's blood work yearly, like 8 or 9 years of age, then usually my cat's gonna make an entrance here. She keeps trying to come and hide in the light box. Okay, Fiona.
She is the reason that this podcast is delayed today, too. And
Yes.
then we started recording and she decided it was time to use the litter box.
I
So,
know. She's the problem. And I just want to tell everyone listening that I was trying to get her to settle down and not bother me during this recording. And I fed her some fancy feast just
mhm.
as like a little peace offering. I never feed you anything like that. And she's still bothering me. She just ate the fancy feast. Okay.
Well, maybe yeah, that's so funny. I think she's like, we don't want to talk about kidney disease. What's that about?
Oh,
What
I
is she telling
know.
us?
Yeah,
Okay.
she's like, I'm so bored. Okay, so we're talking about kidney disease, and cats have kidney disease for a long time before they have symptoms. And let's see, I need to figure out how I'm going to prevent her from doing this. Okay, there we go. Cats have kidney disease for a long time before they ever have symptoms. We usually find it on paper first, and then we do what we can to optimize their kidney function.
Uh,
No.
I have to acknowledge how funny this is because how are you being able to talk and do this at the same time?
One time I was on live TV for Stella and Chewy's, and I had to manage a dog and answer live questions from
Oh my gosh,
newscasters.
so
And
hard.
it's just a secret power of mine.
I am watching. I'm like, it's so amazing at this dual tasking that's happening. And there's a tail going across the screen, and Dr. Angie is picking up her cat and still talking about kidney disease. So we
Totally.
will get focused
Okay.
when Fiona
Okay.
allows
I
us.
think she's gone for a minute. Okay, so you should start testing your cat's blood. So if you're listening to this podcast and your cat doesn't already have kidney disease and you think, well, how do I detect kidney disease? Usually we detect it on blood work. And I like to start like 8, 9, 10, checking blood work once a year. And then if I find kidney disease, I like to start checking every 6 months, which is greedy. I know
Yeah.
it's greedy,
Oh, it's not greedy.
but
I'm
I
still
want all
laughing.
the information.
I'm still laughing because I still hear your cat doing something.
Oh
What
yeah,
is,
now she got her basket of toys because I have a basket of toys, and
uh-huh.
now she's picked the toy out of the basket, and now she's chasing it around.
It's so fitting for a cat episode. So I'm gonna reflect back because so I heard you say that you like to start blood work somewhere between 8, 9, and 10 years of
Yes,
age, doing it annually. And if you
yes.
can be really greedy, once you detect kidney disease every 6 months.
Yeah, if I could have whatever I wanted in the form of information as a clinician, I want to know how the BUN and creatinine, those are the two most sensitive indicators of kidney function. And I want to know those every 6 months. I want to
Uh,
follow those.
Yeah. Do you see that? That will tell you what I'm imagining it's telling you if you're tracking that every 6 months on a cat with kidney disease, how quickly their kidney disease is progressing.
Yes. Yep.
Uh-huh.
I want to get a sense of how quickly this is going to move along. For most cats, if we're doing regular blood work and they get diagnosed with their kidney disease early, so maybe their creatinine's in the high ones or low twos, then I like to check in because we're likely managing this for years.
Uh,
This is a diagnosis we make and then know we have years of life left, usually.
uh-huh. And I have seen, and I'm sure you have seen, when people get that first diagnosis, even if it's the earliest stage, like it's just kidney disease is barely popping up on the blood work, the fear still presents. It's scary to hear that.
It's horrifying because the word kidney failure has your cat's in kidney failure. And so, when it's a vital organ and we're telling you it's failing, that's terrifying. And
Uh-huh.
so most people come pretty upset, pretty disturbed. And so I just want, if you're listening to this and your cat just got diagnosed with kidney disease and their creatinine still in the one or twos, like it's like we have time.
Uh-huh.
Yes.
Uh-huh.
The other thing I'll say is that the reason I like to look at it over 6 months, like every 6 months over years, is that sometimes cats get dehydrated or sick and their creatinine is high. And it's not necessarily because they have kidney disease, it's because they're dehydrated. We call
Uh,
that pre-renal azotemia. And it doesn't tell us much. So we need kind of 2 points in time. 1 point in time doesn't tell me enough information.
uh, fair. That's so fair. And with insurance, people might do blood work every 6 months. Yeah.
Yeah,
It's
did
actually
did
not that terrible of an expense.
no. I mean, it depends on where you're running it. I've definitely, from doing relief at different clinics, some clinics' blood work is really expensive. And other clinics have found ways, like what we did, where you tell IDEX, like, hey, this is the panel I want to run, and they give you special pricing so you can make it more affordable. So you can do smaller panels.
Can you also speak to what creatinine does in the body and BUN? What
Yeah,
those
so
two values are?
basically what you're thinking about is that the kidneys are filtering toxins out of the blood. So your cat's blood runs through the kidneys, and when the kidneys are not the filter that they used to be, that those markers, toxins, those chemicals stay in the bloodstream. So we find them at higher levels. So instead of peeing them out, they stay in the blood, and that's why they get increased.
Hmm. Perfect. Because I've always
Yeah.
actually wondered, like, we don't do urinalysis for every kitty and kidney disease, but is it a good marker of function?
So the urinalysis can be important because it tells us how concentrated the urine is, which tells us how well the kidneys are working. So if you have a cat that's been sick, maybe hasn't eaten for a few days, and you do blood work and you find a high creatinine, high BUN, it doesn't necessarily mean the kidneys are failing. So that's when it's good to go do a urinalysis where we look to see how concentrated the kidneys are. Because that's the kidney's job, is to filter the blood and make urine. And if that urine is really concentrated, likely we have good kidney function. We're just dehydrated.
Okay, that's thank you for sharing all that. That's like it
Yeah.
kind of really narrows the scope down of what those numbers actually mean and what's happening.
Yes.
Feels a little less scary. Um, I was wondering also, so once people get this diagnosis, they want to know if they could have prevented it. And
Yes.
I mean that is one question that gets asked. And I have heard you say in every appointment, any kitty that lives to be senior years, we're going to see some form of kidney disease.
Yeah. Like 99.9% of the time, there's something going on. Every once in a while, I'll see a cat that just has perfect kidneys for life, but that is the exception. So most cats are going to get kidney disease, but it's not necessarily going to be the disease that ends their life. And so, can we prevent kidney disease? We don't really know, but there are things that we can do to support your cat's kidney function because we know there are ways that we can precipitate kidney disease, like with toxins, like lilies. And
Uh-huh.
so there are things that we can do to damage the kidneys, like having low blood pressure. That can damage the kidneys. Most of the time, cats don't have low blood pressure, but under anesthesia, if we're not monitoring blood pressure, that could damage the kidneys. So there are things that we could do to hurt the kidneys. But one thing we can do to support the kidneys is to have your kitty stay hydrated, which is it's a really kind of hard thing to do because cats are desert animals. They don't feel thirsty and they're terrible at hydration. They don't carry around the Stanley Cups like we do and focus so
Well,
much on
yeah,
their hydration. And so we have to we have to
I just
find ways
imagined that,
to trick
right?
them
Like,
into
'cause
drinking.
They have these human water bottles now. I don't know if you've seen these that actually have a digital, it keeps track of how many ounces you drink, and then it like gives you reminders that you need to drink again, and it's crazy time to me. It's like your phone going off, like it's time to stand again. And so at some point you just ignore it. But I can't, I was imagining a cat being told like
Yeah.
you haven't reached your hydration minimum
Your
for the
hydration
day.
goal.
Yeah.
Yes. So we have to trick them and we do things like fountains. So cats really like moving water. So I'm a fan of fountains. Some cats just want you to turn on the faucet, and that's fine too, if you can do that. And then we like to put as much moisture in their food. So whether that's a canned diet or a commercial raw diet, and if you're doing a commercial dehydrated raw, if you could add water back in, that's ideal.
Is kibble dehydrating?
Kibble is
Is it
dehydrating.
compounding the lack of moisture?
Yeah, I mean, some cats with that are eating kibble will drink more water, which is great, but some don't. There are so many reasons why I don't like kibble, and I suppose this is one of them, but I don't know that I have any data to back me up to say kidney disease is going to be precipitated by feeding your cat kibble. So
No,
I won't make that claim, but don't do it for a lot of reasons if you can.
if you can. Exactly. Okay, and so I heard you talk about low blood pressure. But
Yes.
once a cat has kidney disease, we're not worrying about low blood pressure. We're worrying about high blood pressure or hypertension. So you have
Yes.
recommendations around that as well. I like at what stage of kidney disease? And
So the
maybe
minute
I'm going to pause us. Maybe we should
okay,
start there because there are stages of kidney disease.
there are stages of kidney disease, and if you want to look them up, go to IRIS, IRIS, kidney disease cats stages. Like Google that. It's a foundation, and it will show you how we categorize your cat's kidney disease, which I think is pretty cool. And so the minute there's any kidney disease at all, I recommend people having their cat's blood pressure checked. Now, I like to do it at home if you can, and we'll get back to that. But after a cat has kidney disease, they are at higher risk of developing high blood pressure. And this high blood pressure rarely has any symptoms. And usually the first symptom we see is that they go blind and they just suddenly go blind because their retinas detach from the back of their eyes. Now, sometimes if we treat it fast enough, we can get a little bit to reattach, but often they're mostly blind. So, because our first symptom is often sudden blindness, I really try to catch hypertension before it causes this. And it's actually really easy to treat. We use a drug called amlodipine, and the pill is so small, you can often hide it in the food.
Yeah, it's
So
like a
my
tic
last
tac.
cat,
It's
it's
probably
like
even small. It's probably even
it's
smaller than tic
so
tac.
small. And we
Yeah.
start with a fourth of a tablet. And
Mhm.
most cats are managed on a fourth of a tablet once a day. And for the most part, we're fixing hypertension, we're helping your cat's organs live much longer, and we're preserving their vision. And so you can get your cat's blood pressure checked. That's the best. And if you can get it done at home, that's even better. When we were doing house calls, you and I would go
Uh-huh.
check blood pressures, but now we have a house call service in the Boulder area that will come to your house, and there are a couple nurses that will do it for your kitty, which I highly recommend
Well,
doing that.
it's going to be the most accurate because your cat is going to be most relaxed at home. I mean, imagine when you go into a doctor's office that and you get a high blood pressure reading, they'll often just say, "Oh yeah, like you're here, you're nervous. That's expected." Your cat is probably feeling that tenfold going into a clinic where there's dogs and new environment and new smells. So it's not going to be the most accurate reading in the clinic.
Yeah, just getting in a cat carrier, like in the
Oh,
house,
fair.
their blood
Yeah.
pressure's high, and then
But
they
if
have
you
the
can
cart
only do
ride.
it in a clinic, it's still a great baseline. At least then we know what
You
your
should
cat's
still do it.
baseline is. But if you have the option to do it at home, it's a
Yeah,
really pleasant experience and a more accurate indicator of where their blood pressure actually is.
bother your veterinarian until they'll come to your home.
You're
Just
just
harass
gonna
them.
get hate mail for that.
I know
That
so many vets are going to be like, what?
Dr. Angie said I should call you again and again and again.
I'd be like, just stop by, send a nurse out.
Well, not every clinic has a Doppler though either, right? Because they're using the
Oh,
automated.
Yes. I'm gonna try to hold my opinion
I
because I want someone to check your cat's blood pressure, even if it's not the machine. Or
uh-huh.
like I prefer Doppler because I think it's more accurate. But maybe I'm old and the Cardell, like the automated systems are better. And maybe I need to update, but I mean, I still see most clinics using a Doppler.
Do you?
I
I feel like
do.
that was the big win for a while when I'd go into a clinic and they had the Cardell. I'm like, wow, this is great. It's so easy.
Yes.
But yes, I
Yes.
hear I'm old too, so there you go.
And the reason why we like the Doppler is it's simpler technology, but it's often more accurate. I'm not saying that I don't know, automated
Yeah, I know.
pressure pressure checkers. I don't know. I think Cardell is a brand. Isn't Cardell a brand?
I don't know, but that's how I know it as is the Cardell.
Yeah.
But like if you're okay, I'm going to just keep equating it to human medicine. So when you go into a doctor and they put on the stethoscope and put the stethoscope on your arm and they pump, 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 pump the little
Yes.
cuff on your arm, that's a doc. Like that's what Dr. Angie appreciates. Versus when you go in and they roll in the machine and just put
Yeah,
the
and it
cuff
goes
on you and push a button.
ring.
Yeah.
Yeah, and you like feel like your arm's gonna fall off because it's
Yeah.
so tight.
The one at Walgreens always says I'm dying from hypertension. And I'm like, ah, because it like pretty much, yeah, the arm's gonna fall off.
Yeah, it's so painful.
That's the difference between the two in terms of
Yes. I
function.
like that. I like
Yeah.
that. Yes. So it's
Okay.
like the technology is way easier, but
Yeah, but I would imagine a lot of listeners don't have access to in-home blood pressures.
I know. I wish I could change that. I wish we could be part of the movement to
Well,
change
and
that, but that's okay.
if you
It
get
is
to see it, oh my gosh, the cuffs, the little blood pressure cuffs for kitties are just so stinking cute because they're so tiny.
they're cute. Yeah, and so we just shave like usually the back leg. I don't know why I'm holding up my hand like it
Because
looks
you're
like
not
a
going to put
paw.
your foot up on the screen.
So imagine my hand is this is the big paw pad. We just
Yeah.
shave like right behind it, like to these vessels, like literally to these vessels, except this is a foot. Um, and what we do is we shave the hair off, and then we put some goo, like some ultrasound goo, and then we put our little Doppler crystal. We put our headphones on, and then we're hearing your kitty's pulse, and then we use a cuff to occlude the vessel, and then that's how we check your kitty's systolic blood pressure. So that's what's
Okay.
going to happen.
It's so fun. I don't know why I love this, but it's cute. And most cats just lie there, like maybe a little
Yeah.
stunned at like what is happening. But it's a
Yes.
pretty, yeah,
It's
they
pretty
don't seem
easy
to
on
really care.
them.
I think the shaving piece is probably the worst of it.
Right. The sound of the clippers. And sometimes we'll do that on a different visit. So don't hesitate to ask your if you are going to see in like an in clinic brick and mortar place, you could be like, "Hey, will you shave a little bit of my cat's hair there so that we can do a Doppler at home?"
Well,
I'm
and if
now
they, if
micromanaging things
well,
way too
I'm going to
much.
micromanage one more step.
Okay.
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 So if they have to go into a clinic and they're giving like gabapentin to help your kitty feel calm on the car ride and such, is that going to impact the accuracy of their blood pressure reading?
Okay, so I just read something conflicting to what I thought. So we used to think no, but now someone said, well, maybe yes. And so
Uh,
we don't know, but it's still worth doing. So if your cat can only go to the clinic with gabapentin, I would still you do the gabapentin because some cats like literally just cannot be handled without a little, feeling a little high. And
uh-huh.
so I would still do it. But we think that maybe it does affect it. But of course, like everything else with cats, we don't have enough studies.
Okay, fair. So we're in the land of
Yeah.
maybe.
We're in the land of maybe now. It used to be no. And I
Okay.
bet someone would still tell us no. But I read something on Vin saying, well, maybe it does. Maybe we
Okay.
were wrong.
Well, I guess we will know or we won't know, but keep getting the blood pressure. Okay.
Yes.
So we've talked about staging. We've talked about blood work. We talked about blood pressure.
Yes.
Let's talk about how long do kitties with kidney disease live?
You diagnose them at stage 1 to 2. We're talking years.
Huh.
And we're going to do a follow-up episode because there's so much to talk about in kidney disease that we're going to do a part 2. And in the part 2, we're going to talk about diet. And it's important to know that your cat's probably going to live for years because it really does affect the choice of diet, in my opinion. So I'll tell
Uh-huh.
you all about that in the next episode. but expect your cat to live for a long time. Now, if your cat is in stage 3 or 4, it's harder to say, especially like stage 4, like end stage kidney disease. I mean, some cats can look pretty poorly on paper and be doing pretty well.
Uh-huh.
That's variable.
So when we do the next episode, we'll talk about diet, like supportive care diet and um,
Yes.
medications.
But there are some things you can do. So when your cat gets diagnosed, the reason why we want to diagnose early is because we want to change some things. And I always like adding a few supplements on. And there's 3, 4, if I can be greedy, supplements I
Uh,
like to add on. The first thing I like to add on is a fish oil.
I'm in a model. I have them all here.
Yes, this
Ba,
is
ba,
what we
ba.
use. Ultra EFA, RX vitamins.
Uh-huh.
Now, if you don't have access to this, I also really like Nordic Naturals, but some kind of omega because it's anti-inflammatory. Kidney disease is caused by inflammation in the kidneys. We won't get into all the pathophysiology, but so anything we can do to decrease inflammation. Now, also, this fish oil is going to help your cat's hair coat. It's going to help your cat's joints, heart. I mean, fish oil is good for everyone. We'll be taking omegas. So
Uh-huh.
that's an easy win, except if your cat doesn't like fish. It's not an easy win. And I am not a fan of fighting cats for supplements. If it's not going to be easy and sustainable, just don't do it. So if your cat's like, I'm not doing fish oil, that is their choice. And I think we should respect that.
And our other recommendation with fish oil is start slow. Like,
Yes, that's a good point.
because
Thank you.
yeah, I mean, it is, some people just want, I would be this person who's like, I'm going to do the full dose right from the get. And some kitties need less for their therapeutic dose.
Because at high enough doses, fish oil is going to give any cat, dog, or person diarrhea. And so,
I was trying to be kind. I don't know. But yeah,
yeah, I know.
that's true.
I'm just going to
Yeah.
say it. So if you go too high, you're going to give your cat diarrhea, which is fine. You can just back off. Sometimes that's how we figure out the highest dose your cat can handle. But just start off, yeah, like don't be a hero. Don't start off with heroic
Like,
doses
I'm going to fix
of
this
fish
kidney
oil.
disease and we're going to do all 2 tablespoons.
So,
Yeah.
yeah, don't do that. Work
Yeah.
up. The other supplement I like are the RX vitamins, the beadlets. Do you have those?
I too have these. These are the beadlets.
Yeah, they are called RX renal feline beadlets. And
Can you hear them?
basically, yes, they're tasteless, which is like such a win for cats. Like getting supplements into cats is so hard. And they have like some herbs and supplements and basically a mixture of things that are going to help decrease inflammation, promote blood flow to the kidneys. So I really like those. Now, if you put these beadlets on your cat's food and your cat's like, I'm not eating them, there's one other thing you can try. You can try like putting them in like a churu stick. So churu sticks are like those long tube pouches that kind of squeeze out. You cut off the top and they squeeze out. The other thing you could do is put him in like a tuna fish or some kind of special treat away from the meal. And if they won't eat them there, then give up because I don't want you. It's okay to admit defeat and say, my cat's not going to eat these. Because, like I said earlier, your cat's likely going to live for years with this. And so, whatever you're doing has to be sustainable every day and not affect your cat's quality of life or affect your relationship with your cat.
Mm. But I will say that RS Vitamins has done a fantastic job in formulating this for cats because it's also nearly odorless. So you can't smell it. It looks like it should be a really smelly product, but
I know. So, how many times do we have people return these because their cats
I
won't?
was just going to say that I think we've only had 2 or 3 returns over the years.
Yeah, it's just not something that happens.
Hmm. And we're
Knock on
very
wood.
generous with our return policy. So people are free to reach out if their cat's not taking it.
Yeah. Yeah, if you
So,
buy this and it doesn't work, then we'll take it back because you shouldn't be stuck with that.
okay, what's next?
The third supplement I like is the CBD. I like, which is really hemp. We need a whole episode on the CBD and hemp,
Oh,
but
100%. Why have we not
yeah,
done that?
I don't know. We'll put it on the
Yeah,
list. So much to talk about.
so much to talk
Um,
about.
so I like RX vitamins, hemp RX
No.
feline, because out of all the CBD formulas, which are just hemp extracts, I have tried, this is the most tasteless. It's near tasteless. Like CBD hemp, it can have like that skunky marijuana smell
Uh-huh.
taste, and cats don't appreciate that. But this, I feel like, is the best out of all of them. You can either put it on your cat's food or you can put it on a freeze-dried treat and give it to your cat. But what this does is it helps modulate inflammation. But if your cat has kidney disease, there's also a really good chance they have arthritis or maybe some anxiety. And so I feel like this is the age group where I feel like they all need CBD because it's so helpful for so many reasons. I think cats, they start to become less mobile and we don't notice. They just hang out more and sleep more, but we think, oh, they're cats, but maybe they're going up and down the stairs less. They're jumping up on the bed less. And so I really like using HempRx to help promote good
Uh-huh.
kidney function and for all the other side benefits.
And I would say when you go to the site, boulderholisticvet.com, and you're looking, we have different CBD options. But for your cat, choose the feline drops because they are made slightly different from the other CBDs that we carry to be more palatable to cats. So it's really, again, pretty tasteless and odorless, and it's so concentrated. So what you might have bought in the store, this is right here, is my cat won't take it, but you're having to give an entire dropper to get a therapeutic
Yeah.
dose. And this one, it's for a lot of cats, it's one drop, not one dropper, one single drop twice a day.
Yes.
It's a little bit to get in.
Yes.
Um,
It's so easy to
uh-huh.
dose compared to other formulations. And we do carry it in the treat. And I don't want to discourage people from getting the treat, but I feel like you can almost make a better treat. I guess I'm just going to do this. I'm just going to discourage the purchase of the treats. But you can even make yourself a better treat with something your cat would like by putting the drop on some, on a cookie or, I mean, cats don't really eat cookies, but like on, like a
Like the freeze
Temptations treat.
dried. Yeah, Temptations or like a freeze dried food. You could probably put it on like one of the
Yes. Yeah, you can do
little
that. And
morsels.
you're going to get more milligrams of CBD. But although we have plenty of people, and plenty of the cats do like the chews, and people feel like, oh, this is easy. I'm giving my cat a treat. And so, I mean, what would you say that we sell more of the oil or more of the chews?
Far more of the oil.
Yeah,
Well,
it's
it's just
better.
more cost effective, I
Yes.
think, and it has, I mean, it's pure. So if somebody's looking at an ingredient deck,
Yeah.
Um,
Like if their
the
cat's
CBD oil
sensitive.
is simply it's MCT oil and hemp. That's it.
Yeah.
So,
And then if I could be like really greedy with supplements, I would
uh-huh.
put your cat on a probiotic because I put everybody on a probiotic. So I like the RX Biotic. There are a lot of good probiotics out there.
Yeah,
That's what I use. And we've bundled all these products together to save you money. And so if you want to go to boulderholisticvet.com/shop, you can go to our bundles. And so you don't have to remember anything I just said. Just go to the bundle and you can buy them all together. And that's what I usually recommend people do when their cat has been diagnosed with kidney disease.
great. And if they had to prioritize one product, one or two, what would it wouldn't be the RX Biotic because that was your greedy choice.
That's my greedy choice. Definitely the fish oil. And then oh, that's tough. Fish oil, maybe the beadlets.
I was going to say the beadlets have science behind them in terms of the blood work that they actually see improvement on blood work
Oh,
in cats
okay.
with
Okay.
cats with kidney disease. So,
I don't think I've looked at those studies, but I know individually a lot. What I really like about the RX beadlets is they have some of the Chinese medicine I
uh-huh.
use. And so it's like, I'm like, oh, I'm getting my, Chinese formula in there with a bunch of other stuff. And then my patient will actually eat it. So that's what
Yeah, I
gets me
think it
most
has like the
excited.
Romania 8 in it, the Romania 8,
Yes.
and yeah.
Yeah, I
So,
like that.
okay,
So
so
yeah,
beadlets. Well, really, you want beadlets fish oil CBD, ideally.
yes, yes.
So,
But you know what I mean? Like beggars can't be choosers. And if your cat will only eat one of them, like that's still a win.
totally.
You're still winning. I'm still
Yeah.
proud of you.
And also, you have, so we're going to do a part two,
We're gonna do part two.
which will come out, a
Hopefully
week or
soon.
so after this. Yeah.
Yeah.
And you also have a kidney disease course.
Yeah. So if you want to learn about my kind of holistic approach, where we talk about everything in this course, yeah, I'm trying to think of anything we don't talk about, but you can go to boulderholisticvet.com. You can go to our courses tab. And then you can use the code TRUTHTAILS.
Yes, it is.
TRUTHTAILS. TRUTHTAILS. And you can get that course for free, which
That's
is very
a
exciting.
super bonus.
Yeah.
Yeah.
That's like all this stuff. And it was a pre-recorded live class. So you can hear people's questions, which are probably similar to questions you would have. And I go through it all. I think it's what, an hour and a half.
Yeah, somewhere
So
around
we
there.
we talk about kidney disease for a long time.
Mm,
So
fantastic.
in part two, what are we going to talk about? We're going to talk about
Diet,
diet, which is,
treatment,
yes, we're going to talk about other treatments
and end of life.
and end of life. Yes, which is years away, hopefully,
Hmm.
if your kitty just got diagnosed with kidney disease. Okay, I
All
think that
right.
wraps it up for today. We would love to hear from you. Please comment wherever you're listening to this podcast. Let us know about your kitty with kidney disease or anything you'd like to hear about, or that you love or hate us. Whatever. Just tell us whatever.
Every veterinarian that you said, it's your veterinarian again and again and again for in-home blood pressure.
Leave me a nasty comment here.
Yes, nasty comments. Here we go.
Okay, we'll see you next time.
Bye.
Bye.